Hello, everybody. Welcome to another episode of Prescribing Lifestyle Podcast. Today, I have a special guest, Amelia Santos. She is a physiotherapist. She specializes in lymphatic health and pelvic floor. So, welcome to the Prescribing Lifestyle Podcast, Amelia.
Hi, Dr. Avi. Thanks for having me. So first of all, I'll let everyone know who I am first. I have been working in the pelvic floor area, specifically in the bowels area in the last 15 years or so. Um, so Also been treating lymphedema and lipodema area as well. So probably a lot of people doesn't know pelvic floor area actually has bowels area to work on as well. So I mainly usually get referrals from gastroenterologists, and this area you do need a little bit more training into it. So you do need to get into a postgrad certificate about pelvic floor first. And then after that, it's just a start. And then I'm just lucky in a way that when after I did my postgrad certificate in pelvic floor, I quickly have my children. Then I didn't practice straight away. So I have my two children, and I end up getting a job 2 years after I have my children. So I work with a physio who is very experienced in the bowels retraining area, dealing with a lot of IBS stuff. So that's why I have got the privilege to learn these skills. So now I basically work with a lot of patients dealing with IBS symptoms, and usually when gastroenterologist has ruled out they have no basic, like no pathological issues, I will then treat them to help them to regulate their bowels, making sure they can empty their bowels with a more regular pattern. Um, and especially for those who have problems with, for example, they might see me if they have problem emptying completely. They might always have a feeling of something still sitting in their rectum when they have complete their bowel motion.
Yeah.
Might feel a lot of bloating all the time.
Mhm.
Um, because sometimes bloating not necessarily be caused by food. It can be
Mm.
caused by not emptying their bowels well. And sometimes you might hear people say alternating. I have IBS symptoms, but IBS symptoms sometimes it can be just a name given to patients who have alternating constipation and
Mhm.
diarrhea. So we
Yeah.
need to find out, oh, why do you have that alternating pattern? And I'm seeing those patients a lot to help them make sure they don't have that alternating pattern again. Once we know that they are not um, like pathology in there. It's just
Mm.
functional symptoms. So I deal with those a lot. And my job is to help them to, if there's a muscle component, I help them with the muscle part to help them learn to relax their muscles inside around the rectum so they can empty. So that's a part of physio that a lot of people don't know. So that's my
Mm.
job. And I work with lipedema and lymphedema patients. So lymphedema and lipedema actually is two different
Mm.
conditions. So lymphedema is basically a protein-rich fluid sitting under the skin. So it can be primary and it can be secondary. Primary means that you are born with a deficient lymphatic system. So sometimes you might not notice it. You might not notice it until later in life, but you never had a surgery before. You never have any issues that could explain you can have this, but you might be born with some lack of lymph nodes,
Mm.
or when they uh your doctor can sometimes organize a scan which can put in a little like some dye into your lymphatic vessels and have a scan. This is called lymphoscintigraphy. So you can see whether there are some deficiency in your lymphatic vessels, and sometimes you are born with some with that condition called primary lymphedema, which means that you have some lymphatic fluid just sitting always in that limb. It can be usually it's one limb. And then you don't have a surgery that caused that deficiency in the system. So it can be one limb, it can be both, depends on the person. But secondary lymphedema, usually you have that in such as breast cancer surgery, very common. You have people who have breast cancer, they might need to remove a lump, they might remove a breast, and then they might have some lymph nodes taken out as well. And then they might have radiotherapy after. And after that, because the lymph nodes being removed, or maybe radiotherapy has caused scarring, for example. So they no longer can manage the fluid in that side of the body. So they develop swelling. So that's lymphedema.
Yeah, wow, I've learned a lot already. That's
So
amazing. Yeah.
lipodema is different. So lipodema is spelled differently. So actually, lipodema, Lipoedema. So this is something that a lot of people still like don't know and only become more aware in the last few years. And we just had a conference actually in Canberra. I haven't been there in person, but I just listened to the playback of the lectures and presentations. And some psychologists, some researchers has presented. Still, a lot of patients sometimes turn up to their doctors, and then they will still be not getting the, I guess, care they need, because it's not that they like it's most of the times it's a lot of people still not aware of the condition. So when they turn to the doctors, sometimes because it's not taught in uni, it's not in the book yet, it's not enough research out there yet, and people sometimes might think that's just obesity.
Yes.
And
I've never been taught this condition until I learned it. Just the last maybe 3-4 years I've learned this condition.
yeah, even for me, like with lymphedema therapists, because with our job, I think we are pushed to be more aware of this condition, because these are the people we see with swelling. So we just have to be I guess is if we, because people usually present to us, they think it is lymphedema. But it's actually not lymphedema. For some people, it is actually lipedema. So we have to learn differentiating that. And nowadays, there are so many researchers out there trying to do research and also try to hopefully make it more aware to the government as well. And hopefully one day it can be on the Medicare system and we have a Medicare number, and hopefully more people can be supported and get proper treatment for that. So let's get back to what it actually is. So lipedema is basically a genetic inflammatory connective tissue disease. So it's mainly affecting the adipose tissues. So unfortunately, you cannot really cure it at this stage. There's no cure for it. But in the past, very long time ago, when I first know about this condition, we thought that it can be progressive, but nowadays we think that it might not be progressive. It's actually can be more control if we're aware of it earlier. So it's actually a thing that it's good to know it might not be progressive.
Mm.
So if we recognize it, and then know how to live a better lifestyle, it's actually a
Yeah.
good thing. Uh,
Yeah, I've sent a few patients to you to test it and
yeah.
see how do you diagnose lipodema?
So lipedema basically is like when you with lipedema, their fat is predominantly it is usually just affecting their limbs, not in their breast, not in their trunk at all. So usually even the waist is not that affected. So usually it's from the waist down.
Yeah.
So usually from the waist down, from the hips and the thighs, the legs, it will be affected, but the feet will be spared.
Yeah. Sure.
So for the arms can be affected, the forearms can be affected, but the hands will be spared.
Yeah. And they're painful fat.
And usually they are painful. There is a little bit of like when they present at the conference, it seems to be there is a little bit of difference in definition between the America and US as well. So in
Mm.
terms of the pain and also the nodules
Mm.
and also the swelling associated with the definition, but no, like there's slight difference in their definition.
Mm-hmm. Yeah.
Okay. So, but in Australia, we always like in general, we will make it simpler. We usually say there are three stages.
Mm-hmm.
Okay, in general, to make it simple, we say that the first stage, usually you will see the skin are more like soft,
Mm-hmm.
more soft. You will still see some cellulite-like skin. And then when you actually in the skin, when you see them, you will still, when you're really touching it, you can still feel a bit of nodules.
Mm-hmm. Yeah.
Like
So that's the early
sometimes,
stage, first
yeah,
stage.
yeah,
Okay.
you can still feel something underneath. And you will see it's predominantly, again, is the distribution of the fat. You can see is quite symmetrical. It's either affecting the both arms or
Mm.
it's the both hips and thighs, and the waist is very usually not affected.
Mm. So the
And
skinny waist.
yeah, skinny waist. So
Okay.
it's not, so whenever you will hear the histories, they will say, "Oh, I might be able to buy tops that fit my body very nice. I can fit a size 6 top,
Yeah.
but then I can never go into a size 6 pants because the thighs are too tight."
Yeah. Okay. Yep. All
Okay.
right.
So they are the typical things you will hear. And I bruise easily.
Yes. Bruising easily is
Yep.
quite typical. Yep.
Yep, and I'm feeling quite achy everywhere, painful,
Mm. Yeah.
achy. And usually they will tell you, I got some of the comorbidities these people usually have, um, uh, like hypermobility.
Yes.
Find there are comorbidities with this group of patients, like in research, there are some comorbidities we usually find. We're not sure why, but it seems like there is a trend. People with lipedema usually have hypermobility,
Yeah.
ADHD,
Okay.
also have maybe polycystic ovaries, why might be sometimes a bit low vitamin D. Sometimes we also see people might have what is that? Um, joint pain, fibromyalgia.
Okay. I
Um,
think POTS come into it as well.
Spots also come into
Yeah,
it
POTS is like
sometimes.
postural orthostatic What is it?
Postural orthostatic tachycardia.
Syndrome?
Um, what is that? POTS syndrome.
Okay, great. Must be genetics. Is it a genetic that
Yeah,
gives
they
them
say
all these?
also because it's triggered by hormones in different
Mm,
stages. Usually they exacerbated by different hormone stages. So usually they will tell you, oh, around puberty, it start to get a little bit like worse when I put on pills. Or when I get pregnant every time, it get a bit worse,
mm,
or menopause. So we don't know whether there's a little bit of endocrine link
mm,
in it.
yes,
Or sometimes people have more carbs that start to
yes,
flare things up.
yep.
Um, and
Inflammation, I think.
yeah, inflammation because it's an inflammatory condition.
Yep.
Um, and some of the things, let me see if I have missed anything. Usually they have a lot of varicose veins as well.
Oh,
Varicose veins, or sometimes maybe thyroid issues. Um, yeah, maybe like psychologically, I guess it's understandable they might have anxiety, depression.
yep, because of the whole condition. So when I
Yeah.
send people to you, you would test it using your probing thing.
So usually with lipedema, unfortunately, there are no definitive tests to
Hmm.
test it.
Mm,
Lymphedema, you
hmm.
can have a machine. We called it a social machine, measure the lymphedema index. You can actually measure the fluid readings to tell if they have lymphedema.
Hmm.
Lipedema, there are no definitive tests.
Hmm.
We know that I think that some researchers say when you actually look at their fat cells, if you take their like fat cells and have a look, their makeup of their fat cells is different. So if you look at a particular area of their cells,
Yeah.
their fat cells is bigger, and there are more fat cells in that one area to like
Yeah.
compare.
Okay.
So but what we can also differentiate is if people come to us, we can tell them if there is any swelling on
Hmm.
top of their lipedema. So we can give them a clinical diagnosis because that's
Yeah.
all we can do is to tell them,
Yes.
do you actually have clinical diagnosis of lipedema?
Hmm.
Okay, but not everyone have swelling lymphedema. So we can tell them if your lipedema has affected your lymphatic system,
Oh,
which
okay.
some people, if they have actually getting quite severe, which has come to like, for example, stage 3, at any stage, what the definition now progressed to. In the past, they have made it to a stage 4, but now they have changed it a bit. So now we say that stage 1 is still like very very like smooth skin, you hardly can tell, you have to look quite close in order to tell the nodules. The second one, you can actually see it quite obvious on the
Mm,
skin.
hmm.
Okay, you can actually see the lumpiness. And the free is more when you can see like the bulging of the fat
Yep.
around the knees as well, like
Yes.
overlapping. So that's more stage 3. But
Okay.
at any stage, you can have a bit of swelling, which we call lymphedema.
Sure. So if the lipedema gets bad enough, then you can get lymphedema. Is that what
Yeah,
happens?
we actually now say that at any stage, you can affect your lymphatic system, which
Yeah.
can make you have lymphedema. So we can use the machine to measure if you have lymphedema.
Oh, okay, sure. So you make a clinical diagnosis about lipedema or lymphedema. What sort of treatment can you provide?
Okay. So usually when you have lymphedema, you can do lymphatic drainage, of course, manual lymphatic drainage to help to assist the system to
Mm-hmm.
move the fluid back. You
Yeah.
can wear compression.
Mm-hmm.
Yeah. You still want them to exercise.
Yeah.
Because lymphatic system, actually the lymphatic vessels doesn't have a pump. Okay,
Mm-hmm.
you actually need the muscles to help to move the fluid back. That's why we want them to exercise.
Yeah.
We also want them to have a healthy lifestyle
Mm-hmm.
so that
Yeah.
they don't increase weight. Okay,
Yes.
when you increase weight, you overload the system. So we don't want that. So with lipodema, sometimes you would wonder, okay, why do you still suggest people to do manual lymphatic drainage if you have lipodema? To me, manual lymphatic drainage is not is a different. If you do it on lipodema patients,
Mm-hmm.
the massage is very different
Mm-hmm.
to the normal lymphatic drainage you
Mm-hmm.
do on lymphedema patients.
Okay. But you can still do lymphatic drainage for lipedema.
It's a different kind of massage.
Different. But if I send them to you, you'll
Yeah,
you
we'll do it, but it's a different kind.
mm-hmm.
Because if you think about if there's no fluid there,
Yeah, the lumpy,
what
painful fat.
what is the point of moving help fluid to go back?
Yeah, yeah. So how does it differ from
But
lymphedema?
treatment is still suggested for pain relief.
Okay. Yeah.
And compression is recommended for pain relief as well.
Mm-hmm.
The what happened is lipedema, you have usually because of the adipose tissue, the
Mm-hmm.
skin is quite thickened because it's inflamed. Yeah,
Yeah.
you got inflammatory process going on. Connective tissue become a bit fibrotic.
Yeah. Like,
Okay.
can you explain to lay people what
Yeah.
fibrotic
So
means?
it's like fibrosis is like sometimes the skin become a bit thickened. It's thinking about your it's like arthritis every day, every morning you become stiffen up in the morning. So it's just like a gel. If it's not as mobile, it glued up a little bit.
Mm.
It's not as fluid anymore. It gels up and becomes a bit more like Play-Doh. Instead of like fluid moving very freely, it gels up, it become a gluey substance.
Yeah, sure.
So it's not as it's not as mobile, those underneath. It's just gel together a little bit.
So those with lipedema, if they come to you, you do manual therapy, you for pain relief, compression stockings, and how
Now
often?
can I
Yeah,
show you something?
yeah, yeah.
Okay. When we do a lymphatic massage,
Mm-hmm.
we will move the fluid from one place to another. We
Yeah,
drag
yeah.
the fluid from one place to another.
Mm-hmm.
So we're not pressing, but we are just moving the fluid from one place and drag it to the other place. Okay?
Yeah, yeah.
Can you see
Yeah,
some
it's just for
fluid?
those who are listening, because we've got audio as well as YouTube people who can see what
Yep.
you're
So
doing.
you are dragging the fluid from one place to another. Okay?
Yeah,
And that's what when facial, they do guasa. You have
yeah,
puppy eyes. They do it like that because they move the fluid to the lymph nodes, okay?
yeah.
Now that's lymphatic drainage.
Mm-hmm.
But when we do, like if you have like thickened tissues, they are very thick. It seems like they are all just can't move. They're stuck.
Yep, yep. They're lumpy and
Okay?
yep,
They're
inflamed.
lumpy. They are sort of they are just like a thick kind of glue that just can't move. If you want to move it, you can't move it at all because they're just like stuck like scars.
Yes.
So what we do is a different type of massage. you're going to feel where is it tight.
Ah,
So
right.
you're going to feel, okay, if this part of the skin is, I feel I need to use my hand to feel which part is tight, and I'm going to do a little stretch to mobilize those tissues.
Yes.
Okay, and I see which part is tight, and then after I make it not tight, iron it out to make it not tight, then
Yeah.
I can slowly move some fluid that's stuck around to get away. But if
Yes.
it's stuck, I need to stretch it first.
Great. All right. Yes. Yeah, I can see the difference. So that's amazing. And then what else can people do with lipedema?
Lipodema, we actually suggest them also is useful if they don't have time. A vibration plate, in the market, sometimes they have those vibration machine.
Yeah.
For those who have not a balance good enough, if they can, you can get onto a vibration plate. Of course, if you are a starter, hold on to something, start off like 5 minutes. Sometimes the vibration plate triggered a muscle stretch reflex action. So it
Mm,
stimulates the muscle to contract, relax, it's like make your muscle to work. And also the vibration help the maybe the with I'm thinking the shaking helps a bit of moving the nodules maybe.
yeah.
Uh,
Yeah.
but maybe also a good mechanism if you think about it, just trigger the overall muscles to stimulate to work, and you help with the lymphatics and everything to move.
Yeah. Yeah. Great. And what about shockwave? I had a lady who had lipedema and she gets
Oh,
shockwave. Tell
yeah.
us about that. Do you do
Uh,
those?
I do have a shockwave machine at my clinic, but there are some patients who there are some precautions and contraindications with
Mm,
shockwave machine. Uh,
mm,
so usually with lipedema patients, I find it is useful, especially when for tight fascia, especially
mm,
people who have tight plantar fascia.
mm,
We use it on that area, and people who have really stubborn, uh, I guess, connective tissue. For example, some areas I can feel like um, I can't really use my hand to loosen up.
yeah.
Um, and I just have limited time, 1 hour to do the whole body.
Yes.
And then that might help me to quicken things a bit. But people who are on blood thinners, which sometimes I do have people like that, or if you feel like they are, the bone are quite fragile,
Mhm.
and they have metals in the body, or they have pacemaker, or blood clot disorders, I cannot use use the shockwave on those people. Um, and usually people who have, I find because lipedema patients usually have some hypermobility as well.
Mm, yeah.
And that's why when they have hypermobility, I think maybe that makes them super tight at times only in some areas because they overcompensate to stabilize their joints. And
Ah,
usually once I relieve the plantar fascia, they
mhm.
might loosen up their whole body, I find.
Wow, that's amazing. That's great. Yeah. So you have been very passionate in spreading the message of making people aware of this condition, lipedema, and that's how we connected. That I've been prescribing ketogenic low carb diets, and you help people with the lipedema.
I think what you are doing is so amazing because I think your area is so important for people who have like lymphedema, and both in lymphedema and lipedema,
Yeah.
and especially in the lipedema, they all advise to go on to low carb, high protein diet. Uh,
Mm,
this is the suggestions for people who have lipedema. Because that is helping them to decrease the inflammation. And most people who have this have lots of benefits for decreasing their pain level.
Right.
Some of them, for example, some people might go on to medication like those GLP-1 medication
Yes.
or
Ozempic and Wegovy
yeah,
and
things like that.
yeah.
But not everyone can, and sometimes some of the drugs might cause them like slow gut and things like that. And um, I am in a position which sometimes could help them with their gut if they have slow transit when they have the side effects of from the drug,
Oh
because
wow. Okay. Yep.
a lot of times people who come to see me are have who have like they have POTS, they might have hypermobility, they might have lipedema, and usually these people do have they have a bowels which are quite stretchy, and
Yep.
they usually their rectum cannot feel their contents in the rectum very well. And a lot of time they have slow transit as well. So I actually have been working with these clients, and sometimes they don't even know their their symptoms of feeling I feel like bloated. I have alternating bowel patterns since I started the drug. They might not know this can be actually getting better by some
Mm.
physiotherapy intervention. So yeah.
Yeah. How do you help them? You help them.
Oh,
Yeah. How do you help the bowel function?
because basically when you I guess there are two groups I can help them.
Hmm.
um, One group is when people change to a low carb diet. um, a lot of times, although it is good to lose weight,
Hmm.
um, but not everyone will be beneficial, not for for their bowels point of view,
Mm.
because some people their whole life might be used to a pattern. They always hang on and not going to poo until they go home, for example.
Mm.
Or they might be having a career that they sometimes, oh, I always hang on because my profession just doesn't allow me to have the flexibility to go to the toilet. So the rectum actually have very high tolerance to hold poo.
Mm.
So sometimes for some people, they might not, they will need a very big poo
Mm.
to give to be aware of the sensation to poo. Okay. So if we decrease carbs, for some people, they might suddenly have a stool less bulky.
Yes, because they're decreasing the fiber as well.
Yeah.
Okay.
So suddenly their poo maybe because I have lots of veggies, I have lots of fruit, lots of good stuff. And then lots of peas, beans, my stool suddenly get more mushy.
Yeah.
And then I cannot feel my stool. And then I suddenly might have days can't feel my stool in there and not going. And then all of a sudden I either not go for days, and suddenly I feel so cramping in my tummy. I feel like I have eaten something wrong and I might have diarrhea.
Yeah.
So these are the things sometimes people come and find it handy because they didn't know they actually have fecal loading that leads them to have these symptoms.
Yeah.
So then I will be implementing what we can do to we will check first, is that the problem? So I will check their rectal sensation and
Mm.
then and work from there. It depends on the patient whether that is the real problem.
Okay, I see. That's amazing. What about the women's health with the pelvic floor prolapse and concerns? Do you work on those people as well?
Yes. So usually people who might, for example, if they have uh, hypermobility, for example,
Hmm.
sometimes people might not have weak pelvic floor,
Hmm.
they actually might have tight pelvic floor sometimes because they might be overworking their pelvic floor to support their body because everything's nice and loose. They work their pelvic floor too hard. So sometimes I might need to assess their muscles to see whether they are too tight or too weak in order to give them the right thing to do. So to stop their symptoms. It can be either leakage or maybe urgency or
Hmm.
maybe um, um, I don't know, maybe difficult to open their bowels or urgency with um, uh, their bowels or maybe prolapse.
Yeah, yeah, like a uterine prolapse if they have a,
Or yeah,
yeah,
or sometimes people even because now they focus more on exercise, and
yes.
sometimes they might say, "Oh, I want to lose weight," but then they go to do this gym exercise, they want to go to do all this, and then they forget they need to use their pelvic floor. And then they might say, oh, after I've started my exercise program, I feel like I start to have more leakage, or
Yeah.
I started to have this. So then I need to make sure they are not actually because what happens is, I'll give you an example. A
Hmm.
lot of people who have the lipodema, or maybe anyone can be not even people with lipodema. We are all taught to tighten our tummy. How many of us are taught to tighten our tummy, or suck our tummy in so that we look great?
That's right. Yes.
Yeah, because we all have a little tummy sometimes. We want to tighten our tummy so that we don't show our tummy.
Yeah.
But when we tighten our tummy too much during the day, what happens is, see, this is the pelvic floor, and
Yeah.
if you already tighten it
Hmm.
a little bit, so let's say the biceps, if you already tighten it,
Yeah.
and I ask you, tighten it when you cough. You can't tighten it anymore when you want to tighten because you already tightened.
Yeah.
So you need to relax it first so that when I ask you, okay, tighten it. So when you cough, you tighten it.
Okay. So we
So
need to learn to relax the pelvic
we
floor
learn
as
to
well.
relax it when you don't need it, and then tighten it when you need it. So you can't always tighten it when you actually don't need it, because a lot of times some people might be already tighten it when you are, because we always already sucking in, and
Yeah.
then pelvic floor work with your tummy together. If you now try to tighten your tummy, you will feel your pelvic floor, which is where your urethra, your pee hole, the vagina area, and your back passage, all that. So if you tighten your tummy, you probably feel those three holes are tightening at the same time. When you
Mm.
relax your tummy, the holes are relaxed. When you tighten, the three holes tighten. When you relax your tummy, the three holes relax. So if you always tighten the tummy, the holes are tightened as well. So if you add on a cough, you probably cannot tighten much when you're coughing. You need to relax your tummy so that when your cough comes on, then you can really tighten it up.
Interesting. So if I send someone through, then you can teach them how to do these exercises and tighten and relax.
Yeah, this is part of my job, and I my
Great.
my passion actually is making sure they can learn it properly so that when they go to exercise, they know how to switch on and switch off.
Amazing, amazing. So just to recap, what sort of conditions do you deal with? What's the list of conditions do you mainly have interest in?
Um, I I usually um, do a lot of bowel conditions,
Hmm.
like a lot of things with anything about bowels,
Okay.
um, because this is something not many people do, I guess. Um,
Yes, no. Usually
uh,
physio is like arms and legs and back
yeah,
pain.
So anything regarding bowels, I'm so passionate about.
Mm-hmm.
And um, lipodema, lymphedema, um, breast cancer. I am
Mm.
very good at helping people releasing their cording after breast cancer. So if someone who have reduced range of movement after their cancer, especially sometimes you might see a little restriction in their movement along their arm, I'm quite good at treating those. And I'm very passionate about advocating not to develop lymphedema after breast cancer. So I like to see them as early as possible, because early detection of at early stage is the best thing to prevent them from having lymphedema after breast cancer.
Amazing. I might send more breast cancer people to you
So
straight
the
away
early,
after
so
surgery.
the earlier we measure the lymphedema index, the earlier we capture in the early months, the better. And I think we together early detection on people who having lipedema, hopefully they won't get to won't think that they have obesity, because a
Mm,
lot of people, if they think they have obesity, I just don't want them to blame themselves. Why am I like that? I already, because a lot of people, they if they don't understand what is their condition, um, they will say why I am so resistant to, I'm doing everything I can and
yes.
I'm still not getting anywhere. Because with lipedema, unfortunately, if you lose 35 kilos, for example, you will lose weight in the area that you have obesity,
All right. Not the
but you
lipedema
but
bits.
not the lipedema fat.
Wow.
So you will lose the obese fat, but you can't lose the lipedema fat. So that's why sometimes people might have weight loss surgery and they might find, how come I still have the fat sitting in my arms
Yeah.
and my legs?
Mm,
And they no longer recommend to use BMI. They will
yeah.
use the waist to height ratio for people to decide whether they are obese. Because in a group of people, the research actually say, in a group of people, if they use the BMI, they will diagnose, like, let me just make sure I don't get it wrong. They almost have half the people, like, so BMI has misclassified 63.6% of women with lipedema as obese,
All right.
while waist to height ratio identified only 31.7%, so half as many.
Wow. Great.
Yeah.
Very
So
interesting.
So very, very important. So at the moment, I think usually when people talk about even they might go to liposuction surgery, which is not
Yeah.
conservative treatment, but liposuction surgery is usually like, they are the ones to remove the lipedema fat.
Mm,
Yeah. So you at the moment, of course, there are surgeons doing research. Dr. Ramin Cheyenne is at St. Vincent's. He is the doing lots of research with his colleagues, and very pioneered in this area as well. So when you do surgery, you remove all these fat, because sometimes the people who get to the stage where they are really morbid, that they can't walk, they can't
mm,
climb stairs, because you can see lots of folding of
Yes.
lipedema fat that you can't even move. So those are conditions that sometimes some people just need to improve their quality of life.
Yes.
But if you are in the early stage, we hope we can sort of help them to recognize it, and so that you don't need to get to that stage.
Yeah, yeah, interesting. That's amazing. I have learned so much from you, Amelia. Can you tell our
Uh,
listeners where they can find you?
My practice is in Canterbury,
Hmm.
on Canterbury Road. I got a website, lymphandflowphysio.com.au, so you can get more information from there. Um,
I'll put all the
so
links in the show notes. Yep.
yeah, yep. And yeah, I
And
got
you're
an
on
Instagram as well. So
Instagram.
most of the people just if you need to come and see me, you can always just give me a text, and that's the best way to contact me.
No problem. Great. All right. I'll put all the information in the show notes.
And also go to Lipodema, Lipodema Australia. That is
Okay.
the best place to go to, because Lipodema Australia, they are the main body to do all the researches and things, and they usually have a lot of information there.
I'll put it in the show notes as well. Amazing. Thank you for your time, Amelia.
Oh, you're very welcome, and thanks for having me.
Great. All right. I hope listeners will get something out of it, especially those who are interested in all the conditions that we've talked about.
Thank
So
you.
thank you, all the listeners, for staying tuned to Prescribing Lifestyle Podcast. Until next time, I'll bring to you another interesting guest. Thank you for staying tuned and listening.